Hey, hi, good afternoon, everyone. Thank you for joining us today. My name is Shubham, and I will be your host and moderator for this session. Today, we have Mr. Ashok, Chief Distribution and Strategy Officer at MediBuddy. We are here to discuss an important and evolving topic, cashless OPD services in India. Welcome, Ashok.
Hey, hi, good afternoon, Shubham. Hi, everyone.
Great. Hey, hi Ashok. Welcome. Just to quickly set up context for everyone, while we talk about cashless OPD services in India, a quick fact is healthcare expenditure as a percentage of GDP has been flat, and Indian government has taken a target to double it with different kind of innovations in the industries, and that's where, according to Niti Aayog report, there is almost 40 crore to 50 crore people missing in middle India, where basically, they are not savvy in terms of any kind of insurance products as well. And with again government vision for 2047, that where every citizen should be insured as a part of insurance, that's where OPD existence comes into place. And that's where today, a lot of insurance companies are also working in terms of bringing insurance products around OPD. So that's where today we're going to talk about OPD insurance or OPD product as such, and how it could be done in a cashless manner, right? Now, let's dive right in. Starting with Ashok, I would want to understand, could you give us more idea in terms of providing an overview of what cashless OPD services entail in India?
Yeah, sure, Shubham. I think before we get into the cashless OPD services per se, right? I think in the beginning, you kind of articulated as why now, right? But I'll just add some more color to that so that we know, or at least we are building up a conversation towards us why OPD and why cashless, right?
Right.
So if you see to post-COVID, health insurance has grown phenomenally, right? And in fact, it grown to the extent that today almost more than one third of all premiums are health insurance premiums. So that's and the focus of this health insurance premium has largely been on the IPD or the sickness care. And like at the beginning, rightly you pointed out that even Niti Aayog called out that there is a good 40 to 50 crore people who are neither funded by the government nor they're able to afford the inpatient care, right? So with this context in place and the fact that the government wants everyone to be insured by 2047, the government cannot be doing everything other than putting its efforts, the disproportionate efforts, I would say, on the bottom of the pyramid. But it's the private industry, including the industry, insurance industry, which has to focus on saying, hey, how do we make the IPD more affordable to this missing middle, right? And to make it more affordable to the missing middle, one of the steps which we as a nation and as a healthcare industry should take is see how do we reduce the number of people actually get into the IPD or sickness care, right? And the first step to do that is forget about preventive. We at least should get into primary care, which means can I give them access to a primary care even before they get into a complications or that may lead to a longer hospitalization, therefore the cost of hospitalization,
Right.
which means the industry as a whole is now moving away or rather trying to move significantly from the IPD to also the primary care. And that's why you see the recent master circular from the IRDA also kind of requesting or asking the general insurance and health insurance companies to focus on offering OPD as a benefit, right? OPD as an insurance benefit. Now that is where we are, which means the industry is ready. There is a customer segment which requires this, and the government cannot be doing a lot about it because the government has a disproportionate effort, and it should rightly be there on the bottom of the pyramid. Now, given the ecosystem has evolved, there is a reason why we believe primary care or OPD will grow. Now comes the complexity of handling this beast called OPD, right? In IPD, while the insurance industry is very old, post liberalization, at least if you take the last 20, 25, 4 years, whatever, since the liberalization, health insurance has grown and it has gone through a phase of reimbursement to cashless in an incremental phase, right? If you see the last data of IRDA also says that roughly around 60% of all IPD claims are today on the basis of cashless. It is a journey, and there have been multiple reasons, including the technology development. Right now, the technology has developed significantly. It's important to look at OPD from that lens, saying that, hey, look, the fact remains that OPD on an average, even today, tends to be around 700 to 1,000 bucks, whereas IPD on the average is anywhere between 70,000 to 1 lakh. Right, you can afford to actually process 30% of claims manually even today in IPD. But in OPD, given the ticket size, one, second, the volume of transactions, right? The volume of transaction is so huge. Just to put in context, the number of consultations that happen in this country is today around 12 billion per year. Okay, and if you then add the number of pharmacy prescriptions coming from it and the number of labs coming from it, it's in all it's like 30 to 35 billion transactions. Even insurance industry is going to handle 10%. That's like 3 billion transactions they have to handle, which are at low value. So low value, high volume transactions at current cost of IPD, claim processing for reimbursement becomes very tough, and that makes it unaffordable for the customer segment, right?
Right.
Therefore, the need is that you have to start right away cashless, or at least start from a 60% cashless. Rather, unlike IPD, where it grew to become 60% cashless, we have to start OPD from at least 60% and then see how do we get to 100%. So that's where we are, and that's the need of the hour, saying that if we are talking about outpatient services, we have to talk uh, cashless in the same breath. Otherwise, this is going to be a non-starter, or it will become a very expensive proposition for the customers as well.
Right, right. Makes sense, Ashok. So, but just taking a step back before, right, today, till date, a lot of these insurance were focused on to the IPD side of it. Now, that is where we see certain products in market coming up, which eventually have certain OPD benefits covered up, right? So, what are the benefits that typically you see from the patient or the customer's side of it, or a normal consumer, that eventually that they can entail getting a OPD insurance first of all?
Yeah. So I think the typical kind of services or benefits which you can expect from an OPD product, because OPD is a concept or a clinical definition, or hospitals use this, right? Outpatient department. We're kind
Yeah.
of using it more as an industry nomenclature. But OPD as a benefit, if you talk about as an insurance benefit, should entail, right? And this is an experience from other markets, should entail access to doctor consultations. And when I say doctor consultation, it has to be both GP and specialist, right? And both remote and in person, right? It's not possible to take away the convenience away from the customer, because given the fact that in our country there are still only 1.3 million doctors, who are registered. Now we assume that 80 to 90% of them are active, and
Hmm.
we are only adding less than 100,000 doctors every year. So for us to make this efficient, we should look at kind of covering both remote consultations and in-person consultations, including the specialist. That's on the consult part.
Yeah.
Now, like we know, all of us as patients, when we go to a doctor, we have a consultation, we have a prescription, and each prescription, like I mentioned in the beginning, has either a pharmacy or a lab or both sometimes, right? And this is more related to the condition which they are currently facing. How much ever we want to think ourselves as a country which is more an NCD burden country, or increasingly becoming NCD or non-communicable diseases burden is increasing, which is like your diabetes, blood pressure, cholesterol, lipid profile, and so on. We still are burdened equally by the infectious diseases, right? Which essentially means, hey, I have a dengue, chikungunya, or typhoid. I need right away fever panel test. I right away need medications for it, is also becoming important. So covering both acute and chronic care as part of the OPD benefits is also important. Although the larger argument, or the argument can be made that we are kind of now have an increasing burden towards NCDs. It's important for us as a country to get both acute and chronic condition benefits to be covered by the OPD insurance benefit.
Got it. Got it. Great. So I think that leads to me and another question more from a consumer front of it. Right now, what will happen eventually, or how the journey will ease for the consumer once let's say OPD becomes, or different kind of benefits, services that you talked about become a part of insurance, how does that makes the life of the consumer easier? That is one. And the second part of it, how can a individual or a user who have purchased, let's say, any kind of OPD kind of insurance products, can transact in a cashless manner?
Hmm. So, see, I think the first part is in your question, like today, why does someone buy an health insurance policy? Health insurance policy, someone buys because they want to kind of part with a small, expense in exchange for a larger benefit, which is like if I get sick, I should be able to go to hospital and be able to foot that bill. On average, today, any hospitalization costs anywhere between 70,000 to 1K, even if it's a medical management case.
Yeah.
So there is a strong proposition there. But at the same time, you cannot expect that kind of a disproportionate benefits in OPD, because OPD is not going to be like we mentioned right in the beginning. OPD is going to be more transactional or high volume transactions. To put in context, the number of surgeries that happen in this country even today range anywhere between 2.5 to 3 crores in a year, right? But the number of consultation we spoke about was almost in 12 billions, right? So that's the kind of difference we are talking about. But like I mentioned in the beginning, the intent is to reduce the number of medical management and surgery cases that will go to IPD, and therefore insurance companies should start looking at how do I offer and make this as a part of an integrated benefit, at least, rather than talking OPD as a separate concept, right? The way it will work, probably eventually, maybe it will start as a OPD as a separate concept, but eventually you will have to make it part of the IPD benefits, so that the customer knows that there is a continuum of care. So, which means essentially, hey, Ashok fell sick today or he has a symptoms of fever. He doesn't know what it is. He doesn't have to wait 2 3 days. Why can't he actually call, speak to a doctor or walk into a clinic to get his himself checked and his prescriptions? If it happens, so let's say because it's a monsoon season and it's a dengue benefit, bite and so on. If you catch them early, then you can monitor them probably at home itself, right? But if you don't catch them early, you'll end up in for hospitalization or say sickness benefit. Therefore it becomes important more for the insurers to articulate these benefits from the perspective saying that, hey, uh, how do I make this insurance, health insurance, affordable for the customer? And by data point, if you see in the last 2 3 years, insurance premiums have gone up anywhere between 40 to 60%. And for group policies, it has even gone up to 90, 100%, right? To make that afford, you can't have this kind of growth in premiums, then the number of people afford will again fall further. So
Yeah.
for the benefit of the customer, which you can't articulate directly to the consumer, you have to integrate these benefits and make sure that it is part of the all the health insurance they have. That makes it easier from selling the proposition and also making the conversation easier with the customer. That is one part of the question.
Got
Now,
it.
the second part of the question you asked is about access of services, right? One thing is about
In a
selling
cash,
insurance benefit. Yeah, go ahead. Sorry.
in a cashless manner, how can someone, avail these services?
Yeah. So this is important because whether we like it or not, people are used to now at least the terminology cashless, right? And cashless digital payments have made it even more, frequent conversation in people. So
Yeah.
aside insurance, also people know digital payments and digital conversations, and therefore they expect that kind of transactions being more seamless when they need a doctor consultation or a prescription to be fulfilled. I'll give you by way of context. Let's assume Ashok is an patient. Now I'm admitted in the hospital. I have a 1 lakh bill. I'm possibly okay to file a reimbursement because it's a 1 lakh rupee, right? But the moment I walk into a doctor clinic and the entire conversation, doctor consultation, pharmacy, and lab, let's say, turns out to be around $1,000. Now, if you don't make it cashless, and if you think ₹1,000 is a reimbursement which he will apply for, that's the first friction, right? For the customer, it becomes bit difficult to put that additional effort to get the ₹1,000 back from the insurer. They might feel that, hey, I might as well do it myself and rather than look for an insurance benefit, which actually is more important for them, because they cannot have the negotiation power as an individual, but as an insurance company or as a larger aggregated player, an insurance company can have a much more higher negotiation power with the doctor, right? So for us to make it easy for the customer, cashless is the word, and at the go you should start with cashless, right? Like I mentioned in the beginning of conversation, start with at least an aim of getting to 60% of cashless, and then progressively move. For that to happen, initially insurance companies may not have that environment where they can enable all of this, because they have been building IPD over a period of time, and TPAs have also played a significant role in helping them to get to where they are in terms of cashless for IPD. But for us to get this immediately done, and like I said, the IRDA circular actually talks about offering the insurance benefit for OPD as early as possible, probably now, right? That's what the circular is all about. So if you have to get started immediately, you need a network. You need a network of doctors. It's not like hospital in this country, maybe around 15-20,000 hospitals, even the small tail hospitals if you include. But doctors, there are more than 1.3 million we mentioned. Then there are pharmacies and labs, which will be around 5.5 to 6 lakhs each. Right now, to get all of them on your platform or in a place where to make it cashflow for the customer becomes difficult. That is where players like ourselves can build in an ecosystem, which we have been running at least for the different sector of customers, both on, I mean, all the three services, which is consults, labs, and medicine seamlessly, right, for the customer to come on a platform and access it. Now, different insurance companies can have a different view, saying that I want to integrate with my system differently because I have a legacy system and so on. Or they may have to want their customers to come on their platform and use these services. It really doesn't matter. In this world of APIization and SDKs and so on, we can we can enable all of this formal models. But the entire policy itself, in fact, it's interesting that IRDA now mandates no physical policy wording should be issued. So it's all digital. In fact, you should have an insurance account to get your policy wordings, right? If that is the case, issuance of policy has to be digital. The servicing of policy is even more has to be digital as much as it possible. Although the end touch point of the service will happen physically, delivery of services, but the booking to reimbursement or cashless way of settlement of claims can happen on a platform which has all this ecosystem built in, and that's where players like Medibody can play a significant role, and insurance companies can look as a catalyst to kind of or a stepping stone for them to kind of move from here. Of course, there are many other players who can offer this, but by virtue of being with a larger network, you always have the ability to, like I mentioned in the beginning, to negotiate and get a better prices, because affordability even for IPD is a problem and will become a problem for OPD if you don't really have a large scale negotiation power, right? And also bring them on the scale. So now, as a customer, how do I utilize it? All I have to is have a digital policy issued, and that policy should as simple as be like the wallet we have in the background of ours, which is a digital wallet, and tell me what kind of benefits I'm eligible for each of the services, and should be able to kind of in a one click make the payment, book, and go ahead and avail the services. So that's how seamless it has to be. Of course, at the back end, there is a lot more work which has to be done by us, which is facing the providers and so on. We'll talk about that later. Yeah.
It actually makes sense. More from a consumer front, it makes the life easier. While if we see all across all the different services, different products, everything is being moved digital. So even on healthcare, I think the first steps would obviously be how do all these things eventually move digital. A lot of players in the industries have been, making this shift also happening, and that's where people are also getting accustomed in terms of digital environment of availing all the OPD or basic services. But with that also, I think introduction of cashless mechanism will solve it in different ways in terms of easy adoption of these services definitely, and even from a user stickiness perspective, because what we have seen across when people are actually facing problems in terms of their health, there isn't anything that strikes them, and having this smoothless experience in terms of a cashless manners, I'm pretty sure will help consumers like me to, avail these benefits in a much more smoother way. So, taking that into consideration, I would want to understand and hear a little bit more in terms of challenges that today health providers eventually are seeing in terms of adopting to the cashless manners, and how much time do you think will eventually take, for these things to eventually come into day-to-day routines for, maximum people?
Yeah. See, I think one of the big pushes which the last decade the government has been doing through the ABDM, Ayushman Bharat Digital Mission, right? In that, if you see, the IRD has been extensively working with ABDM to ensure that the National Health Claim Exchange is built, and I think it's going to be live next month rather, and it's probably going to be in a phased manner. But what's the objective of this National Health Exchange? Today, the way it works is Ashok has a policy, Ashok's insurer has a set of providers, and whenever Ashok has a problem, he goes back to the TPA or the insurance company, avails the services either cashless manner or in a reimbursement manner. So it's a kind of a silo which has been built. Now, what NHCX is doing, or the National Claim Exchange is doing, is building an intermediate layer wherein it is saying that Ashok as a customer will now be able to interact using his insurance policy with multiple providers, and his data is his previous records or in the health claim exchange, which brings the interoperability. Let's say, well, first I met a doctor X, today I am unwell, I'm have to go, or I've been referred to a specialist, I have to meet Dr. Y. What happens is the document exchange today takes time. Ashok has to carry his current records, previous records, etc., and that becomes a difficult problem. Now, because of this, it seamlessly passes to the provider. At the same time, it also provides goes to the insurance company, right? So it has kind of put all the ingredients required. Of course, there will be a lot more teething problems to solve at the tail, but what it has done is structurally it has solved in a way how the information flow for or health records flow between various players, and that's the starting point which they have began for IPD. Can it be expanded to OPD and all? Yes, of course, that's the intent, right? Now, we as a player, we kind of being working very closely with ABDM from the beginning, can be the front end, and that's the kind of example we always talk about, whether it's a Google Pay or a Phone Pay. At the end of the day, the backend is the strong backend which was built by our payment NPCI, right? So that's what enables this two large apps. Similarly, a customer may have a customer-facing app which can be a MediBuddy app or a insurance app which is powered by a MediBuddy. But at the backend, it can be integrated to this large ecosystem. Eventually, although in a phased-wise manner, it will happen, which brings a lot of interoperability. And also, at some point, the longitudinal data of Ashok from, let's say, 2024, when I'm talking about 2034, 10 years down the line, I will have all the records. That makes it even more useful, because as a country, we are not going to remain young forever. We will also get older at some point. Of course, different states will get older at different points. And at that point of time, the expenditure will be much higher for the healthcare, and therefore it's important to look at all the previous data and provide right products and services for the customers. So it not only solves for today, it also solves for the long. To me, that's more important, and that's also the reason why getting started as cashless as much as possible, and I would put this golden number again and again, start at least with an objective of getting 60% cashless and move quickly into 100% for various reasons which I mentioned earlier. And that kind of helps both the payer, which is the insurance company, the patient, which is customers like ourselves, and most importantly, we didn't talk about one more person in the ecosystem, which is the providers, right? Providers will also not want to wait forever for a 700 rupees or 1,000 rupees to come into their bank account, which takes like 30 days to settle that, right? And multiple documentation and follow up from their side is also something they will not kind of like it. And that I think this kind of health claim exchange enabled, and players like ourselves enabling at the front end, and also bringing the ecosystem of the providers, which is provider definition itself has changed now, which is your labs, pharmacies or physiotherapy and so on, whatever benefits you can talk about. This will help us to build a very robust delivery services and payment mechanisms for the primary insurance, and why not for even the sickness insurance.
Understood. I think it eventually, if we have to generalize, it will take slight time in terms of adoption, even for the health providers, service providers. And once I think I see network being one of the most critical piece into the entire cashless journey, which needs to be, robust enough so that, every insurance companies, every, consumer who is buying these kind of cashless products can actually avail these benefits. So from that, I would want to understand a little bit in terms of, how has been the cashless adoption while it is still at a very nascent stage across India, and how Medibuddy has seen in this journey where, Medibuddy is working today with, as I hear, 1,000+ corporates, right, helping their employees with different kind of cashless wallets and OPD services. So how has been the adoption that, Medibuddy as such has seen with the set of existing and the new clients, and how much efforts and awareness does it takes to eventually uh, give consideration for these cashless benefits to be availed by the consumer?
Yeah. I think I was also trying to answer the earlier question, right? How much time will it take is a function of how ready the ecosystem is. And what do I mean by the ecosystem? In the ecosystem, the prominent players are the patients ready, the providers ready, and the payers ready. And more importantly, should be a sponsor, and that sponsor is often, in our case, the government of India, right? And for us, luckily, at least the government of India has taken that necessary steps in form of ABDM, which I talked about earlier. So there is already this push from the government saying that, hey, don't want anything to be other than digital format of transactions, right? Of course, it will take a journey, but the initial inertia in a system is much difficult to break than actually building momentum. So the inertia has been broken by the government of India, and then thanks to them and the IRDA's effort, and we have been hearing a lot about IRDA's thematic push saying that it has to be cashless anywhere and everywhere, right? So and the industry is working along with the IRDA to make sure that this happens at least in the IPD space. So I think the inertia has been broken and the momentum has been added by the payers, which is the insurance industry. And the government has also given, not just broken the inertia, but also given a backbone for them to kind of work with it. So with that, I think we have saved a good 50 to 60% of time, which took for IPD to get to 60% cashless. So in my sense, that has saved almost two-thirds of the time. Now, are patients ready, which we already talked about, right? Patients are now very much aware about cashless services. The fact that because they do a lot more digital transactions, and in this country now, at least I don't carry wallet anymore, and most of us don't carry wallet. In fact, it's difficult to lend money without asking what is. I mean, can I scan and share? Those days we used to get cash from each other and all that. That has all completely gone away. So I think that, like I mentioned, the payer is ready, the patient is ready, the government has provided the necessary mechanism. It's a question of execution, right? Because there is a lot more problems, as it's not as simple as we are talking here today. There are a lot more problems to be solved at. For example, we still don't have procedure level codes. We still don't know how to translate, or at least we don't know how to translate complex policy wordings into cashless delivery of services. For example, in IPD you will have so many exclusions and all, which you have a time to go through. Even if you give a cashless approval, you still have a time to go through and make the payment, or necessarily reduce the payment. Here the patient is in and out, because it's an OPD care by nature. The doctor will not hold you more than 10-12 minutes. So in that whole time frame, you have to make sure that the customer is getting the cashless service. Therefore, the product nature has to be very simple, and I would even think it should be closer somewhere to a subscription kind of a service. And that is something which we at Medibuddy kind of have experimented with a lot with our corporate customers. And interestingly, even in those services, when we started, there were a lot more or a greater proportion of reimbursement, which we have seen significant move towards cashless. And the well aware high utilization customers in the corporate world, there are different segments, right? The higher you move into a higher income segment, you kind of generally utilize more on the OPD benefits. But coming back to the point, even they were kind of more comfortable with reimbursement, and that has changed significantly. It has grown to almost like two-thirds of cashless on an average, and in some corporates it's as good as 100% cashless. And it has also expanded in the services of which we talked about, right? It is not just anymore consults, labs, and medicines. It's also about home care or a vision care or a dental care and so on. I think that there is no limit for anything other than outside, I mean, other than what has to be delivered in the hospital or outside hospital services can all be part of this cashless environment eventually. So I think I would like to summarize the question which you asked as a response, saying that everyone is ready. There is enough inertia has been broken, the momentum has been added, and technology has evolved. And players like ourselves have tested and know have some learnings, significant learnings, to kind of further accelerate this momentum. So timeline wise, I think anywhere within a year we should be able to get to 60%, assuming today we launch all of the industry launches OPD benefits, at least for the basic consults, lab, medicine services and so on. And I think that will only accelerate further and get to 100% quickly, because the industry has to get there, and there's no other way to do this business. And some of them who have done this business have understood that on average it costs anywhere between 500 to 700 rupees to process a claim IPD. It doesn't matter whether it's an IPD or OPD claim, the cost remains the same. You cannot afford to have that kind of cost, and therefore there is additional momentum coming from the patient demand and also the provider side saying, I don't want to incur this cost, and the insurer also doesn't want to incur this kind of cost. So cashless is an mode of delivery of services, or probably the only way of delivering services, may become the norm. And just to put some context to it, like for example in US, here we talk about cashless and reimbursement. In US, no one, or at least the clients I've managed in the US, right, it's very rare actually you will talk about reimbursement, and these kind of conversations happen only in kind of advanced therapies. When we are talking about gene therapy, and the kind of claims I at least used to look at is largely $1 million plus, and experimental therapies, robotic surgeries, and all, which are not your norm, right? Otherwise cashless is like a given theme there, and I think that's the only way to get there. And despite they getting to 90-95% cashless kind of environment, healthcare costs have significantly increased. And imagine if medical inflation plus operational inefficiencies were continue to exist, the government's theme and dream of getting, like you mentioned in the beginning, to have everyone insured by 2047 will become very distant. I don't think that the government is willing to take any chance on that. So for sure, they will keep on pushing, and they will continue to break the inertia. And the regulator has played a fantastic role, and the industry also has played well along with them. I think all of this will make sure that this cashless world will grow faster. It's just that we have to step on as an industry to take that first step, test, learn, and move forward. And that's where we are.
Right. I think great insights, and I think great to understand how Medibody is ready with certain set of products or technology which could be extended to different kind of insurers. And obviously, while being at Medibody, I have seen how easy it is for someone to avail these cashless benefits. I think just last question for this round. I want to understand, let's say, today, if any of the partners in the industries wants to extend Medibody benefits, whether it's any kind of a company or any kind of insurers, how easily they can start working with Medibody and start giving cashless benefits with one of the biggest networks in terms of diagnostics, in terms of doctor consultation or pharmacy that Medibody today have associated with them.
Yeah. See, before I get into that response, right, I want to make one point, because we all talked about it's the first step we are beginning with, but it is going to be something rapidly accelerated phase, which means your starting point is never going to be fully grown product. And if anyone says that we have a fully ready product to address the next 2-3 years, maybe we are kidding ourselves, because the system has to be kind of learning from the industry and evolve. And that's also one of the reasons why we kind of engage very closely with payers like insurance companies, our providers, and also our customers, to make sure that we incorporate learning at all stage and eventually make a full-fledged fully ready system. So that's it. it is good enough to start, and that is where I was emphasizing, let's not wait for an arrival point. You have to start somewhere and get to the arrival point, right? And the starting point is well developed, well oiled machinery, largely because of our experience. And our experience has been kind of largely in the three major services, which is, like I mentioned, doctor consultation, labs, and medicines. Of course, there are other services, but let's focus on this core three services. In these three services, if someone wants to offer benefit to their whether it's an employee or their customer, whether you call it as an insurance product or a subscription product or a value added service, it's a different ways of paying for someone's services, right? All the services can be offered seamlessly because over a period of time we kind of have built that network, right? And the best part is the way we go about building network is also, we kind of see where the providers are and how the payers are kind of growing their markets, which for example, an insurance company, while all insurance companies are pan India by nature of license, they have specific zones and areas where they focus, right? And similarly, we know that kind of what kind of providers are available. You know, you can't expect probably in a tier 3 town is kind of lab which is available in a tier 1 or a metro. And therefore we have a wide range of labs and wide range of pharmacies, including like you can walk into a store and pick up your benefits, but at the same time you can do it cashlessly, right? So to answer the question, how easy it is for any of this payer, whether it's a corporate or insurance player, whether you offer it as an insurance product or a VAS or an employee benefit, I think as long as you're offering the core services, the standard benefits, and you know your network and where they utilize it, I think it's a matter of day or two for them to get onboarded and start utilizing the services. If it is an insurance product, of course, there is a bit of a nuances attached to it because each insurance company has its own risk management policy, and therefore will say, I want to design a benefit like this, which means there are rules around how much I can utilize, who can utilize, what's the kind of a copay, and so on. These are a bit of rules, and we have an extensively customizable rule engine which has been built. Whether in fact even corporates do that now, you know, at the different layers of customer, I mean employees, they have different benefits and different copays and so on. And some of the PSUs have well run oiled machineries in terms of the healthcare benefits, are also closely working with us, right? And that's the nature of complexity they have in their benefit structure. So to me, the core services, core benefits with decent, I mean, expected set of rules, I would call, for someone to avail the benefits, which is more about your policy wordings or the kind of benefit rules you have. All this can be done in a day or two for any customer segment, as long as they're kind of utilizing it on our app. Of course, if it has to be integration with the payer, which is the insurance company, or distributor of the insurance company, that may take little time depending on what kind of technological environment prevails in their system, right? That's a bit of a determinant here. But other than that, I think we are kind of at least ready to enable the industry and work along with the government's mission of ABDM. In fact, we are very closely working with them to make sure that the long-term journey is secure. It's just that you have to take step by step to get there, and faster steps, because we can't afford to take slow steps here. I think, yeah, to answer your question, I think 24-48 hours is something we could expect anyone to go live, and with the core benefits.
Right. No, I think that's interesting, how quickly people can start extending all the cashless benefits to the entire, either its employees or to the end customers. And I think with MediBuddy, it becomes much more easier also in terms of availing the cashless benefits. So yeah, I think cashless, while we speak, is the way forward. It is for all the different kind of payers to understand and start availing and building their network from a cashless manner as early as it's possible, because that will help them with early mover advantage as well, how this overall is changing. And it's great to have all your valuable insights today on cashless outpatient services across how the industry is evolving. Thanks a lot, Ashok. I think hope audience listening to this webinar would also be able to get a lot of informative information out of this, and it would definitely be helpful. And at MediBuddy, as MediBuddy is fully ready, MediBuddy can also be a part into the entire journey of the cashless for all the insurers, all the employers. So yeah, I think pretty good in terms of it. Wishing everyone a great day, and we look forward to having more sessions in the coming days where we will talk about different nitty-gritties of cashless services, how the OPD is evolving, with different kind of partners into the entire system, into this entire journey. So, any concluding last thoughts from your Ashok before we end?
Yeah, maybe I'll take 1 minute. I think we are a nation which did even satellite launch at almost 1/10 cost, right? Unfortunately, we have no choice other than figuring out cost-efficient mechanisms. So, to me, cashless will be kind of synonymous with claims. That's the only way to kind of manage healthcare costs. And the government has realized it, and the regulator has realized it. Even the patients know that, right? So for us, cashless will, I mean, claims will be equal to cashless at some point, and that's the way we look at how we kind of move this needle from whatever 60%, 70% we have today towards a 100% world. And I'm pretty sure that's the thinking the industry also has. And as we have do more of this engagement with different players of the ecosystem, we will also understand, how to kind of accelerate this. But yes, exciting times ahead, and the only way the vision of the government of 2047 ensure everyone will happen through cashless. And I think that's the backbone, and I'm glad that we can help the industry and grow along with the industry to make sure that the patients get affordable healthcare services. And that's the most important point here, right? At the end of the day, if it's not affordable, Hmm. It's going to be a tough job for all of us, whether it's a payer or provider. So let's talk cashless in the same breath as healthcare is my parting statement. And thanks to everyone who has spent time today, and maybe will spend time later listening to us. So thanks again, and have a nice day.
Thanks, Ashok, once again. Thanks everyone for joining us. Stay tuned for next sessions. Goodbye, everyone. Stay